Welcome to the Old Fashioned Health Network, Good Health Inside and Out. I'm Alvin, host of the Old Fashioned Health Show. And on today's show, we have a special guest. We have George Pratt, Chief of Health Services of the Jacksonville Sheriff's Office. Welcome to the show.
Thank you, Al.
So today we're going to dive into, I got a few questions trying to understand exactly what it is that you do as being Chief of the Health Services.
Well, Alvin, Sheriff Mike Williams just recently appointed me to Chief of Health Services, and what that entitles is I am responsible health administrator for correctional medical attention in the jail.
Okay.
And that comprises of Chief of Health Services, comprised of a senior management team. We have a lead physician, Dr. Barnes. We have senior management, nurse of operations manager. We have mental health manager. We have a psychiatrist. We have 5 mental health counselors. We have a dentist, dental techs, CMAs, LPNs, a pharmacist. So just imagine a small clinic or a very small hospital within the jail system.
Okay, so you have everything that civilian life has on the outside, you have on the inside.
Correct, yes.
So on the inside, you deal with the same thing as like diabetes, high blood pressure, and all those kind of things as we do outside of the civilian.
Sure. We are also responsible for providing service with what you would call chronic care.
Okay.
Cancer, diabetes, hypertension. We also have infectious control. We have wound care. So yes, those would be, special units that would take care of those services.
So how do you do it with both the male and the female? So is it just one particular that you handle, or you handle both, all of them together, just over the jail?
Sure. The jail holds about 3,000 inmates.
Okay.
And there's quite a few females there that we house on our lower level, and they would come to the clinic at their personal times, at their respective times, and then the males come at appointed times. So we try to keep them at different times, but a lot of times they're there together. And in that environment, it's like a small clinic. So services are provided, and they get the treatment that they need.
So isn't it kind of, to me, I'm thinking most people on the outside seem to think that what's going on the outside as far as medical facilities is concerned, it's not like going to Grady here in Atlanta versus being incarcerated and you actually get a stomachache, feel good. Do they just call up and say, I'm sick, and what do you have for me, or how does it work?
Yes, inmates have to request medical service.
Okay.
They can do that by putting in a medical request slip.
Okay.
And our turnaround is within 24 hours.
Okay.
So if an individual just is catching a cold or feel like they're coming down with a common cold, they will put in a request slip. That slip would be turned in, and within 24 hours we would be seeing that individual.
For you, it seems like you just are really passionate about it, or have to have some type of passion to want to do it.
Yes. Well, I've been in the field for 23 years. I started off as a correctional officer. Stayed a correctional officer for about 4 years. Was promoted to sergeant, and I stayed sergeant for 17 years. And so I have a lot of compassion. And the thing is, when you provide custody care and control for an inmate population, you have to be passionate about it, or you really don't do a good job at it. So I really found my niche within the Jacksonville Sheriff's Office. I had the opportunity to supervise pretrial services for 14 years, and that really gave me the compassion within the law enforcement field to help individuals get their lives back on track. And then I was appointed to assistant chief of the jail, and then I served as jail services assistant chief, and that is providing all the services. It's a city within itself. Food service contract, commissary contract, just mattresses, you wouldn't, pillows, providing all the services that are needed to run that facility. You wouldn't believe what it takes to run a jail of that size. And now being appointed to or promoted to Chief of Health Services, now I really get to oversee the entire medical staff, really provide efficient and effective medical services.
Okay. Well, we're going to take a break.
Sure.
So we'll be right back. All right, welcome back. Well, what does an average day look like in the jail when it comes to needing medical assistance? What does it look like?
Well, Alvin, we see over 100 inmates daily in our clinic. We start out about 4:30. Of course, it's a 24-hour service, but we start out about 4:30 in the morning seeing our diabetics. And you probably have 40, 50 diabetics that we'll see within an hour of time. And of course, they need their medicine prior to breakfast,
Right.
and to stabilize their sugar levels.
Right.
And an average day in the clinic, we would see male inmates, female inmates. You would have individuals with appointments to dentistry. We do extractions in the jail. We don't do any root canals or any type of services like that. We do extractions. Now you have to realize, Alan, most of the inmates that we see don't keep up with preventive health care.
Okay.
So we're seeing individuals that usually don't have a primary physician, don't go to the dentist quite as often as they should. So we provide those services, and we see people that are indigent and cannot afford medical services on the outside.
Wow. You know, I'm just playing in my mind, just imagining. I think I really feel bad because it's like I feel like I forgot about what actually, once a person is locked away, you almost forget about that they have needs, just like I do. You know, so
Yes.
that's really that's interesting. So the diabetics or people that's on high blood pressure pills and stuff like that, and they have to take them at a certain time.
And insulin.
And insulin. So you all have to go around and provide this to them.
Well, with the diabetics, they come to the clinic.
Okay.
And they take care of their treatment there. But we have nurses that pass meds throughout the facility, and they would be passing meds pretty much all their shift. We have about 6 floors in the jail. Once again, over about 3,000 inmates. Med call could be mental health meds, psychotropic meds, or it could be just for the common cold or for, just pain medication.
So with it just not only being medicine, I think you said you all also provide psychological type of, so then you got inmates that need counseling and sitting down and talking to mental health as well, right? Not
Yes.
just medicine.
Yes, and as we stated, you asked me before, what is, probably the most crucial treatment going on right now, and I would have to pinpoint mental health. Mental health is crucial right now. I say that because, Alvin, a lot of mental health goes undiagnosed coming into the facility.
Right.
When you come to jail, we ask you certain questions. We give you an assessment. Every inmate that comes into the jail is given a med screen. And through that med screen, we would ask you particular questions. And a lot of individuals just won't self-report. And then we have to find out through their behavior that they have mental health issues. But we have a psychiatrist on staff, we have a mental health manager, and 5 mental health counselors on staff. And they see numerous of inmates throughout their shift.
I really, really appreciate you coming sharing this information with us. I'm still so fascinated by the fact that it's like a hospital inside of a jail.
Yes, exactly.
Wow.
Exactly. And I thank you for the opportunity.
We appreciate you
This
coming.
has been a joy.
Thank you. Thank you all for watching. Have a good day.